Hi, my name is Michael and I'm the Principal Chiropractor here at Chichester Chiropractic Health Centre. Now today I'm going to be walking you through some stretches for your hips, helping to open up, gain more mobility, take pressure off the nerves, take pressure off the joints and ultimately get the muscles working in a more efficient manner. Now while doing these stretches, if you get any discomfort, if it doesn't feel right, if it causes any pinching either during or afterwards, please back off next time you come to do these. If for whatever reason you're unable to find a comfortable way of doing this, please stop altogether, and when we pick up next with the chiropractor, they'll work out why and then give you something that's more appropriate for you. Otherwise, let's get to it. So here I'm going to show you some stretches for your hips. Now some of these are very similar to the ones that you're going to be doing if you are doing lower back stretches. However, there's going to be a few additions here that are very specific to helping to gain mobility into your hips. Now these are fairly basic stretches, so if you need anything that's more advanced than these, please let your chiropractor know. So for these, we're going to get you to lay onto your back. So knees bent to 90 degrees. Now for the first one, we're going to look to open up your hip. So you're going to drop one leg down, again flex the toes because it really helps to keep that brace to the floor. You're going to bring your foot up so the ankle sits just over the top of the knee and just let that leg gently drop out by itself. At first, just let gravity do the job. Now you might get a few little clicks, pops when you do this. It's very common, there's nothing wrong with that. And then you can take your hand and just traction and push down and away. So you're really opening up that hip, stretching up all those muscles. Hold there 10, 15 seconds. Slowly release, bring back to center. You're then going to take the hands onto the top of the knee and just bring that knee as close into your chest as possible. Now some will bring it straight towards the chest, but if you find that either it feels very restricted or there's any pinching into the hip, just slightly bring it out to the side as you bring it up and in. So you're pulling it more to the shoulder than you are to the chest. Bring that in 10, 15 seconds and then slowly let that one release. From there, we're going to take it in the opposite direction. So you're going to step the foot slightly away from the knee and you're going to let that come gently into across the body. Now this is more of a stretch into the glutes. It really gets into those sacroiliac joints. Holding there again 10, 15 seconds. And then for the next one, we're going to bring your pelvis across. So where your right hip was sitting, you're going to take your left hip to that rough position, tuck the foot just in behind the knee, and then you're going to bring it across. This is an even deeper stretch. It's really pulling that hip out of the socket, getting into the glutes and getting into the sacroiliac joints. 10, 15 seconds, slowly release. Now there's one more thing we need to release, which are these hip flexors. So I'm going to show you the floor-based version of this. So you're going to come onto the knee. Now if you find that kneeling is uncomfortable, get a small cushion or pillow and put it under the knee. Just adds that little bit of cushioning to make it more comfortable for you. You're going to then bring the other leg out in front, take your hands across the top here, and you're just gently moving forward. So you're getting a nice stretch into those hip flexors. It's really opening up that hip. Hold there again, 10, 15 seconds, slowly release. Whatever you do on one side of the body, assuming it's comfortable, please do that on the opposite side of the body as well. Now, if you have any questions, any issues with these, please let your chiropractor know. Otherwise, for most people, it's appropriate to do these twice a day, once in the morning, once in the evening. Otherwise, enjoy these stretches.